Let me tell you about VCU Radiation Oncology.
Hi, and welcome to our virtual program introduction. I sure wish we were really sitting together in my office. But nonetheless, I am Emma Fields, the program director here at Virginia Commonwealth University in Richmond, Virginia. I've been here in Richmond for just over 7 years since I graduated from the University of Colorado in 2013, and I've been the program director here for 3 years now. I specialize in GI and GYN, so I do lots of brachytherapy and SBRT treatments. But one of my primary areas of interest is education and working with residents as well as medical students. Radiation oncology job market is, of course, a primary concern for applicants, especially this year. Our residents at VCU have had no trouble over the past 7 years finding jobs in desirable locations and practices. In fact, our senior residents now, Josh and Anthony, found jobs quickly and both close to their hometowns in Florida and Pennsylvania. The residents, or prior residents, noted here in bold, have all agreed to be sources of information for you about our program. There's more information about how to contact them on the SWAY sheet that Joe has sent you. So please reach out to them for any questions because they certainly have insider knowledge. And here's just a graphic of where our residents from the last 7 years are practicing. The yellow stars indicate academic programs and the blue stars indicate private practices. So you can see we have diverse locations in diverse practices across the entire nation. This was an email that I received from Jenna Kahn last year when she started her practice in Portland, Oregon, when she turned in her case logs. So just to let you know that our residents really are prepared to hit the ground running when they arrive at their practice. As well as preparing you to hit the ground running when you start your job, we certainly prepare you to pass your boards. We have protected time for residents on Thursday mornings from 7 to 11 a.m. for clinical education. We typically cover one disease site per month, and then we also have journal clubs and M&Ms quarterly. There's also protected time on Tuesday afternoons for physics in the fall and radiation biology in the spring. There are visiting professors that the residents invite, at least 2 per year. We also host yearly mock oral exams that are typically in February, so the residents get great practice on how to pass those. Residents get access to RadOnc questions for 5 years, so during their 4 years in our program and the year following. And then we also offer lots of hands-on educational experiences and workshops, which I'm going to tell you more about. To go over some of the strengths of our program, I would say first and foremost is brachytherapy. The experience with brachytherapy is hands down one of the best. We do within our department the placement of breast balloons and catheters. We also do HDR for prostate. I myself do the GYN, so we do GYN intracavitary treatments. We also do a lot of hybrid applicators and interstitial cases. Sometimes we do more rare things like rectal brachy as well as skin. And we have anesthesia support daily in our department. And these are pictures here of our procedure room. We're so lucky we have a dedicated nurse, actually nurses now because we've been so busy, as well as a dosimetrist and physicist. So we're able to turn our cases over quite quickly. There's some cases that we do in the operating room, such as placing our SIVA sheets for pancreas cancer, and sometimes laying catheters for things like sarcomas. Another one of the huge strengths of our program is the department commitment to resident education. Here's a picture of Anthony Rico, one of our senior residents who just received the RSNA Research Award from Dr. Weiss, who he worked with during the last 6 months. Here's a picture of the resident crew. We did a gastric cancer Jeopardy, so you can see them all there with their buzzers, looking totally excited. You probably have heard of the IROC curriculum. This is the introductory curriculum for incoming PGY2 residents. There's part of that we do with all of the residents, at least prior to this past year, that we do a sim workshop so that everybody gets comfortable with all of the immobilization. Here they are doing a contrast toast so that they can know what the experience of drinking contrast is when they talk to their patients. And here you can see Chris Chipko getting a tattoo. And Chris McLaughlin, who's now an attending at UVA, trying out the active breathing control. Similarly, you can see here Jenna looking at some of the head and neck immobilization, and Dave Cooper doing the prone breastboard. But it's a great time where residents can teach each other and also just try out things that they haven't necessarily seen yet. Of course, this year was a little bit different, but we still had our PGY2 residents, physics involvement, as well as medical students participating, and everybody got tattoos this summer. Additionally, we yearly do our hands-on image verification workshop. We all know that as our treatments get more fancy, we use tighter margins, higher doses per fraction. An accurate patient setup is crucial for the success of these treatments, but there's really no formal education on image alignment or review. So Dr. Laura Padilla in physics and I developed this workshop to expose the residents to this because it's really something that's done kind of behind the scenes, either after hours or at the treatment machines by the attendings alone. And here's some pictures from a prior year with all the residents sort of working in teams to figure out how they want to match their images. We also do some brachytherapy hands-on workshops. This is an example of our GYN workshop with some pelvic models where we're getting our hands on the tandem and ovoids, placing the applicators, and then actually scanning their own applicator placement and evaluating themselves. We also included some contouring and treatment planning as part of this workshop and have combined this with UVA as well. They've come and done the workshop with us, and we've gone to their center for a prostate workshop as well. So lots of fun collaboration. Another strength of our program, and perhaps this should even be first, but we have an extremely collegial resident and faculty group. This is a picture from last summer, actually in my backyard with all of the residents, but we really enjoy each other and like getting together. This was one of the Black Lives Matter events, and you can see this was around lunchtime on a Friday. Just the experience at VCU, as well as the representation from our faculty, our residents. One of our social workers is also in this picture, and a physicist. So this was really a special day, and it was nice to see so much commitment from our department. Here's a larger look at what we did. This was our makeshift Astro Happy Hour this year. We found an outside spot to go on the Wednesday evening and have some wine. This is a place called Bramley Park, which is in Scott's Addition. And I think you're going to find out a lot more about Richmond if you haven't visited. But it's really a cool place. Lots of fun breweries, wineries, lots of things outdoors to do. So this is just an example. And this was our Women Who Curie picture. This is Bridget, and of course me and Laura Padilla, one of our physicists. And actually this is in my front yard. So we do like getting together with each other and spending time outside of work. This is a little bit dated now, but this is at one of the Brachytherapy Society meetings. Because we do so much brachytherapy, we take a big crew when we go to brachytherapy meetings. And actually, this is a nice representation because we like to meet up with our former graduates as well as former medical students. And I think you'll find that once you come to VCU and join our group, you really become part of our family. Of course, you're coming to our program for clinical training, and I want to assure you that the clinical training here is outstanding. One of these experiences is at the VA. The residents rotate 2 to 3 times for their 3-month blocks at our VA hospital, where we have 4 dedicated rad-onc attendings. At the VA, we do LDR prostate brachytherapy. Also, residents have a bit more independence there and really just have the privilege of caring for our veterans. We also have a community practice experience as part of Dr. Urdanetta's rotation. You get to go to Hanover, which is one of our satellite centers, just 1 day a week and see how practice runs in that setting, which is great when you're looking for a job. You'll have experienced these different settings and really know and be able to tailor your search more appropriately. We also have an incredibly diverse patient population. We're a CatchNet hospital located in the center of the state, so we really cater to central and eastern Virginia. We draw from all the way up north to northern Virginia down to the North Carolina border, and take both the urban population as well as quite rural. So you're going to see everything that you need to become a fantastic radiation oncologist. And Richmond is really a great place to live. I know I talked about it a bit before, but there's lots of great neighborhoods. It's a surprisingly very active population. I was worried when I moved from Colorado here, but lots of runners, bikers, hikers. There's the James River runs through the city. So there's lots of trails. People do rafting along the James River. There's also great shopping, dining, lots of fun festivals to go to on the weekends. It's close to the mountains and the beach, so about 1.5 hours either way. And there's no traffic, so that's great. And you really do have time to enjoy these things. We are not going to work you to the bone. So how does it work? We have 42 months of clinical rotations that are divided into 3-month blocks. There's an optional 1-month away rotation at St. Jude. You can get all of your pediatric cases in our department, but lots of our residents like to do this 1 month. You get to stay in a nice condo in Memphis, and you also get proton experience when you do that. We do have a 6-month research rotation, which I know some people think is too short. But when you're on service, there's no cross coverage. So you do get some time on your clinical service to actually work on these more longitudinal projects. So you can get much more done than you think. People have done all kinds of things on their research rotations, from being in the radiation biology lab, working on physics projects, doing clinical outcomes-based research, and even a mix of all three. You should definitely talk to our residents about this. Bridget Quinn is somebody who's doing a mix of everything right now. And there's also a potential for extended time. We recently had a resident who had a lot of interest in research, and he extended this to 9 months. Our residents, because they're so active in research, have had the opportunity to go to many meetings, and as you can see, be on the podium. In the center is Jenna winning a grant from the American Brachytherapy Society. Bridget even presented at the American Brachytherapy Society as a medical student, but at Astro also. More recently, we've had residents go to ACRO, and I think this year Raj is going to the radiosurgery meeting that's coming up in the spring. So lots of great opportunities. We are also starting an in-house research grant for our residents that will give additional funding to allow for some of this extra travel when we all can travel. In the meantime, we're stuck on Zoom, but we have had some fun. This was one of the breakout rooms from the ROCSIG meeting, the Radiation Oncology Education Collaborative Study Group. It's a bit of a mouthful, but you can see in one of my breakout rooms, I was lucky enough to have Jenna in there, and she put on her crown, her tiara. I gave her from when she graduated because we always joked and called her Princess Con. This is just so cool. Sherry Zhao, who graduated just over a year ago, got a grant, actually through ACRO, to go to China and spend a month there. So she worked in a rural Chinese hospital and got hands-on experience with many very different experiences. She was also asked to present while she was there, so you can see her looking very serious, but just had such a phenomenal experience. And I know this is something lots of people are interested in doing, and we support it 100%. So I think there's more to come on that. Obviously, we're all a bit grounded right now, but I think that's definitely subject to change. This was just a really brief overview, touching on some of the highlights of our program, but we really are looking forward to meeting you and hearing all about you as well. Thank you.